This Wednesday conversation. You may not hear a lot about it unless it affects you or someone you care about. But sickle cell disease is still very much around. According to the CDC, it impacts more than 100,000 Americans, mostly people of color. Now, this is Sickle Cell Awareness Month, and we're going to take a detailed look at this disease, what it is, how it's treated, and how those who have it live with it. My guests are Dr. James Taylor VI, Director of the Center for Sickle Cell Disease at Howard University Hospital. Also, Ashanti Jean-Claude, sophomore biology major right here at Howard University. She also has sickle cell disease. If you have a comment, if you have a question, as always, our lines are open. Give us a call at 202-319-7810, 202-319-7810. You can X me at HFisher, WHUR, or find me on Instagram at Harold T. Fisher. Thank you so much for coming in, Dr. Taylor. Ashanti, thank you much. I really appreciate you spending some time with us.
Pleasure to be here.
So let me first start with the basics, Dr. Taylor. And certainly, you've been on this program many, many times before, but it can't be said enough that people really need to understand what sickle cell disease is and how it affects the body.
Right. So it's a genetic disease, meaning you inherit it from your parents. They have to be carriers, and the mutation is in the hemoglobin gene. Hemoglobin is a protein that fills red cells and carries oxygen to your body. When you have two copies of the mutation, the red cells become rigid and sharp and take on a sickle shape instead of a nice donut-shaped disc. That does two things. The rigid cells clog up the blood vessels and deprive your tissue of oxygen. That causes organ damage and, most importantly, pain episodes. And then the other thing is the red cells don't survive a long time, so your blood counts are very low and you're anemic.
This is, as you said, this is a genetic disease. So, and you said when you're talking about two parents with it, is it possible if you just have perhaps one parent, or what are the percentages of those who have it with one parent versus two?
So the carriers are people with sickle cell trait, and that's about 12 out of 100 African Americans, about 12% of the population.
Mm-hmm. Why does this seem to mostly affect people of color? What is the common denominator?
The mutation arose in Africa sometime in the relatively recent past. We're all of African descent if you go back far enough. Mm-hmm. But in the recent past, that's when the sickle mutation arose. And it protects against malaria, which is a parasite that infects red cells. Mm-hmm. And it kills children in Africa who are under 5. If you have sickle cell trait, you will not die. So you're more likely to grow up and have kids. But if you have trait, you have a 1 in 4 chance, if the other parent has trait, of having a child with sickle cell with each pregnancy. It's not like you have one and you're ready to go. It's 1 in 4 chance with each pregnancy.
What are the symptoms?
I think our esteemed guest could probably describe that a little better. I mean, I would say episodes of pain that can happen suddenly and unexpectedly. Those are the visible things. That's what usually comes into the hospital. Mm-hmm. Acute pain, and we're talking severe.
Yeah. Ashanti, talk to me about that, about your story. When did you first realize that this was an issue? You and I, we kind of chatted a little earlier, and you said you were very, very young. But when did you know that something was not quite right?
Okay, so I was an infant when I was diagnosed with sickle cell anemia. Mm-hmm. However, I first realized it was a real problem when I believe I was about 7 or 8 years old. I was in summer camp, and we had gone to a water park for the day. And this was in Indiana because I'm from Indiana. And it was really cold outside. Not really cold, but, cold enough. But I did not know how to properly manage my condition because I was still young. I didn't know how serious it was. But as soon as I had gotten out the pool with my other friends, I had been experiencing a really bad tightness in my chest and a lot of pain in my chest. And later that night, my mom had to take me to the ER, and I believe I was hospitalized for about a week. Don't quote me on that. I'm not too sure how long I was in there. I just know I was in there for a minute, and I was experiencing what is called acute chest syndrome, which is when the cells sickle in your chest along with pneumonia. And that was due to the fact that I was in the cold water and I had come out and I was surrounded by cold air, and so it triggered a pain crisis for me. So that was the first time that I realized, okay, this is probably something I need to pay more attention to.
What is the issue with colder temperatures?
We don't understand that. I can tell you we've done studies here at Howard and in my prior job about temperature sensitivity. That is one of the triggers that we know of. You can tell this when patients come to clinic during the winter. They're wearing long underwear and wrapped up and warm because that is one of the known triggers, among other things. Changes in weather. So when the barometric pressure drops, when a storm blows through town, you know this because the hospital fills up or the emergency room will fill up with sickle cell patients.
What about during the warmer months? Are people less likely to be triggered, or does that matter at all?
Heat can trigger it too. You could probably tell me better than I can say it.
Yeah, I have a story for the heat as well. I have the story for the cold and the heat. Because I know when I was little, my mom had this rule for me. I'm not allowed to be outside playing for more than 10, 15 minutes if it's above 75 degrees or below 55 degrees because it's extreme temperature. For some reason, that triggers it. So I remember this one time I had been traveling because I took a gap year before I came to school, and I was volunteering in Dominican Republic for a school, and I was outside painting a mural, and I had been bent down on my knees for about an hour, no breaks, no water, so I was a little dehydrated, and as soon as I stood up, I realized, oh no, I had made a mistake. Because that had triggered a crisis in both of my knees. So, and that one actually lasted a couple weeks. I had to fly home early. I had been to 3 different ERs just because it was too hot out there and I was not drinking enough water. And I was overexerting myself for the limits that I had because of sickle cell.
When you say a crisis in your knees, what do you mean?
So my knees were swollen. The problem is with joints, that's where you have, I'm sure Dr. Taylor can tell you the science behind this probably better than me, but from what I understand, you have the smaller blood vessels that go into your joints. And so with sickle cell, the red blood cells are stickier and they get stuck to each other, and so it's even harder when they get stuck in those capillaries in your joints. So especially because I was bending down on my knees painting the wall, I feel as though that's a big part of what triggered it, and so they would swell up and they would get really hot and it would just be like
She
really
just cut off
painful.
the blood supply to her knees.
Yeah.
And that's the bottom line. And it's oxygen is not getting to those tissues. When you don't get oxygen somewhere, either the tissue dies or it hurts.
Wow. 202-319-7810, 202-319-7810. This is a Wellness Wednesday conversation. Of course, this is Sickle Cell Awareness Month, and we are taking a detailed look at the disease, what it is, how it's treated, as well as how those who have it are living with it. If you have a comment, if you have a question, our lines are open right now at 202-319-7810, 202-319-7810. And I have so much to ask about this, but even before we continue, I did briefly want to talk about the Move On event, the annual event, Dr. Taylor, that was scheduled for this coming Saturday. It has been postponed because of the weather.
Yes. Weather prediction is rain and wind.
Okay.
Bad combination for sickle cell. So it is now postponed to September 30th, 1 week later on Saturday.
But you can still register for the event.
Can still register, and free T-shirts are still available. It's a 100% free event.
Okay. So what is expected to happen during this Move On event that you have every year, and of course this year?
So this will be a 5K run walk up across the Howard Yard and back down in front of the hospital. But we also have the Move On event, which is yoga, jazzercise, etc., for those who are less mobile, including many of our patients who may or may not feel up to walking 5K.
Okay, so just keep in mind that that event that was scheduled for the 23rd Saturday, this coming Saturday, it has been postponed until September 30th. And as always, not only this podcast, but other kinds of resource information, including information about that event, will be posted on our website on WHUR.com after 9 o'clock tonight. I'm going to go to the phone lines, 202-319-7810, 202-319-7810. Susan calling from D.C. Susan, thanks for calling. What's on your mind?
Yeah, I was diagnosed with the trait when I was young. I got heavily anemic, and after they did much testing, they told me that over 70% of my cells were sickled. And I haven't had any problems since young age, and I was just wondering, are there any symptoms for people that have trait? Is there anything that I should be concerned about?
If you have trait, there are a few rare things that can occur, but it generally does not come to medical attention. I would recommend, from what you've described over the phone, go and see a hematologist. There may be something more there.
Okay. All right. Now she just basically what she's saying is that she has the trait, but
Right.
you've not felt ill, have you, Susan?
No, I haven't been ill since I was little. I was anemic, and that was the only reason why. And I'm just wondering, do they routinely check you if you're African American for the trait? Because I actually have two daughters, and one of them, the firstborn, they checked because they sent me to a place to have my husband checked also to see if he was a carrier, had the trait. So she came out with it. But the second baby, they didn't check, and I didn't find out until she had a genealogy done, one of those DNA genealogy, and then she got the medical one, and it came back that she had the trait also. And I was just curious as why they don't routinely check.
So starting in 1975, actually starting here at Howard University, Freedman's Hospital in 1948, the founder of the center did the first newborn screening study, and it was on sickle cell. It was 1948. Starting in 1975, New York State started sickle cell trait screening for every child born in that state, and now universally across every state, and this is why Ashanti was diagnosed before she can remember, every child in every state, regardless of ancestry, is tested for hemoglobin disorders.
Okay.
Okay. All right. Thank you so much.
Susan, thank you so much for your phone call. 202-319-7810, 202-319-7810. This is our Wellness Wednesday conversation. We are talking about sickle cell disease. If you have a comment or a question, give us a call. Maureen, calling from Laurel. Thanks for calling, Maureen. What's on your mind?
Yes, good evening.
Hi.
I was listening to the young lady talk about when she had a crisis and pain in her knee and in her chest. But I witnessed someone having a crisis, and it seemed to be the entire body. Is that possible? I mean, she was in so much pain. She wouldn't let anyone touch her. We had to call emergency. but it just seems to be her entire body being affected.
Ashanti, your thoughts about that?
Yes, so from my experience, whenever I've had a sickle cell crisis, I've felt it in either multiple other places or everywhere. Like when I was describing that story about when I had the crisis in my knees, and these were two of the worst experiences I've had when it came to sickle cell. I couldn't walk for a while because I was experiencing pain not just in my knees, but in my legs, in my hips, in my feet, everywhere. My feet were swollen, my hands were swollen, and I'm not sure why that happens, but the pain spreads is what happens. It spreads.
And we're talking about pain. The way it's been described to me from the other side of the bedside is it's almost as bad as breaking your leg bone. You know, something that would be incredibly painful. That's the magnitude of pain that the patients experience.
Would you agree with that? Or?
I would agree because that time it was the worst pain I had ever experienced. I couldn't sleep for weeks, for days. I was just up, screaming, crying. My twin sister, she was there with me throughout the entire time because we would be traveling together. And she was a very big support for me during that time. But it was definitely the worst pain I had experienced.
Maureen, well, there you have it. Thank you so much for your phone call. 202-319-7810, 202-319-7810. This is our Wellness Wednesday conversation. We're talking about sickle cell disease. If you have a comment or a question about it, give us a call. Patricia, calling from Maryland. Patricia, thanks for calling. What's on your mind?
Hi, good evening. How are you?
Doing just fine, thanks.
I adopted a little girl from Howard Hospital, and her mom didn't know that she was that she had sickle cell trait. But when they told me before I took her home that she had sickle cell disease, but she's still carrying her mom's fetal hemoglobin. She's 4 years old now, and the last time we went to the doctor, the fetal hemoglobin was 19.8 or something like that. But right now she's just taking the penicillin twice a day, and she gets transcranial ultrasound because she doesn't have any symptoms or sign as of yet, but I guess they wanted to make sure there's no lesions or anything growing in the head. But should I still be, more protective of her as far as, putting her in water? She likes the hot tub, so, I let her do the hot tub, but as far as the pool, that's a iffy.
So, excellent question. So, one, it's great that she is getting care. You really need specialized care, and this is now designed to prevent problems before they happen, which is great. I think Ashanti's mom's rules of, when it's cold, don't go outside. When it's too hot, don't go outside. I think those are really great rules. I'd never heard anybody describe that. That's what we should be telling parents when their children have sickle cell. I would talk to the child's care team about what you can do to set up an environment and just be really proactive about making sure that things don't happen. Because what a child has today, they can go on a lot longer in the future than ever before if we're very careful about delivering care early in life.
Patricia, thank you so much for your...
I would like to add something.
Before you do, because I've got it, you're quite welcome, Patricia. Hold that thought, Ashanti. Don't forget it, because I do have to take a very short break. Angela, calling from Southeast. Sheila, calling from Maryland. Please do not hang up. We will be talking to you next. Lines are still open at 202-319-7810, 202-319-7810. This is our Wellness Wednesday conversation. We're talking about sickle cell disease. We will have more in just a bit. So stay with us. The Daily Drum will continue on Sirius XM Channel 141 and WHUT TV. I'm Harold Fisher. John Mons is next with the original Quiet Storm. That's on WHUR. We'll be back with this conversation in just a few seconds.
On the go and on demand, WHUR and WHUT are with you. Download the WHUR app today to get full access to shows, playlists, and our latest contests. To access WHUT on demand, download the PBS app and make Howard University Television your station. Catch up on our WHUT original productions anytime, anyplace on YouTube at WHUT TV. WHUR and WHUT, better together.
DC, Maryland, and Virginia, you might have noticed something a little different on Monday nights at 8 p.m. I'm Angie Ange, our Director of Content here at WHUT. And Monday nights at 8 p.m., we like to call it Must See DMV. All your favorite shows from all your favorite creators, focused solely on what makes DC, Maryland, and Virginia so special. So set your clock, and we'll catch you at 8 p.m. right here on WHUT, Howard University Television, telling your stories on your station.
Welcome back to the Daily Drum on Sirius XM Channel 141 and WHUT TV. I'm Harold Fisher. We continue our Wellness Wednesday conversation. This is Sickle Cell Awareness Month, and we are taking a detailed look at this disease, what it is, how it's treated, and how those who have it live with it. My guests are Dr. James Taylor VI, Director of the Center for Sickle Cell Disease at Howard University Hospital, and Ashanti Jean-Claude, sophomore biology major at Howard University. She has sickle cell disease. Lines are still open at 202-319-7810, 202-319-7810. You can X me at HFisher, WHUR, or you can find me on Instagram at Harold T. Fisher. Before the break, Ashanti, you wanted to share some information about that last phone call.
Yes, I'm hoping our previous caller, Miss Patricia, is still listening, because this was in response to the limits that she should be setting, for her daughter. That was a difficult thing for me, from what I remember when I was little, was following those rules that it seemed like nobody else had to follow. I remember getting upset with my mom, and I hate that I got upset.
Yeah. How did that work out for you?
I know. Not too well. But for one, I love hot tubs. I would like to say that I love hot tubs. They help me. They make me feel better for some odd reason. It's the heat, I think, that kind of just relaxes my muscles, which is very much needed. And when it comes to getting in the pool, as Dr. Taylor said, it's definitely very important to keep in touch with your child's doctors and make sure to take their advice. But it's also, I think, important for her to learn her own body, because no one's going to know your body like you do. And no one's going to advocate for your body and your health like you do. So having a balance, I think, is very important when it comes to that.
Thank you so much. I hope that Ms. Patricia is hearing that. I think that's some really, really good advice. I want to go back to the phone lines, 202-319-7810, 202-319-7810. Angela calling from Southeast D.C. Angela, thanks for calling. What's on your mind?
Thank you, Harold.
Sure thing.
Thank you for having this discussion. As a big sister to a younger brother who grew up with sickle cell disease, I lived with the same rules that Ashanti lived with. My brother couldn't do things, so I would volunteer not to do the same things so he wouldn't feel alone in the process. So, Ashanti, thank you for sharing your story, and maybe that will help other families who struggle, taking care of a child with sickle cell. I don't have sickle cell. My brother does, because my mother and his father both were affected. But my husband carries the trait, and our youngest child, we have three. Our youngest child, our son, has the trait, and he has G6PD, and I really don't understand the G6PD. All I know is that he can't have flavonoids, and I keep him away from sulfur.
So I was hoping the doctor could give me more information about it, because when I Google it, it doesn't say much.
And it's G6
G6PD.
PD. Okay.
It is a red cell enzyme. It has mutations in it. It's on the X chromosome. And like sickle cell trait, if you have G6PD deficiency, meaning a mutation in the gene, you're protected against malaria, and that's why it arose. And it can cause, under the right conditions, we call this fancy word oxidative stress. Things like fava beans will cause that. There's a few other things that can cause that. If that happens, the red cells become fragile and can break open, similar to sickle cells not surviving a long time. You become anemic and have all sorts of problems.
Angela, well, there you have it. Thank you so much. I hope we were able to give you some additional information. And thank you so much for your phone call. 202-319-7810. 202-319-7810. Sheila, calling from Maryland. Thanks for calling, Sheila. What's on your mind?
Hi. I have 4 kids. One child doesn't have the trait nor the disease. My oldest child and my youngest child both have the disease. My oldest child was diagnosed with the disease at the age of 4. When he was born, they told us he had the sickle cell trait. We didn't realize he had the actual disease until he was 4 years old, and he suffered from pneumonia, and they couldn't figure out why he kept carrying a fever. And then my ex-husband was in the military. Then one of the doctors did a sickle cell test on both of us and determined that each one of us has the trait, and my son has the disease. Now, he has fared good. He had a high hemoglobin count. We found that out through a medical research at the Medical College of Georgia, and that's why his fetal hemoglobin is high, so he had less incident of crisis. However, my last son, he don't fare that well. He just started, he's 14 years old. He just started doing really, really well about 6 years ago when he was prescribed hydroxyurea. Hydroxyurea has really, really changed the scope of his disease. He takes it once a day. I think it's 1,500 milligrams, and he has not had a crisis, nor has he had a acute chest syndrome. So I would advise all parents, although there's a mandate, get your child tested, even if your doctor does not mention it, because it can be life-saving. If we were not at the right place at the right time, anything could have happened to my younger son. So that's my advice to all parents that are dealing with sickle cell traits in their family. My husband, my ex-husband, nor I know how far back the trait goes, because neither one of our families, as we know, were directly affected, but it's definitely within the gene line.
You were nodding your head, Ashanti. You were going to think you were saying something. You were nodding your head in response to what she was saying. Did you have some thoughts about what she was sharing?
I was mostly just listening and taking it all in, because I really hate that they had to experience that misdiagnosis at first, and it took so long. And it just reminded me of I take hydroxyurea, and I know that it helps me a lot. I take the same dosage that she was describing, and I know that it helps me a lot. That's all I was thinking about.
My only comment would be that we live in an era of genomic medicine, and the way that we're doing newborn screening is by proteins. That can be affected by the amount of fetal hemoglobin you have, by transfusions, other factors. We should just be sequencing DNA. It's a very simple test, and you'd never miss any of these. And it's very unfortunate. Occasionally, they are missed, and I've seen a few, and they can be somewhat complex, and probably what happened in this case.
Sheila, thank you so much for your phone call. Before I take another phone call, first of all, you said hydroxyurea. What is that?
Hydroxyurea is a form of chemotherapy. It's a drug that's been around for many decades. And sometime in the 1970s, people realized that they were testing it in animals, and they got high fetal hemoglobin. And one of the cancer researchers asked a hematologist, why is this happening? And he said, I don't know. And soon after that, there were sickle cell patients in a hospital getting this experimental drug, and it raised their fetal hemoglobin. Fetal hemoglobin is baby hemoglobin, and it blocks that sickling. So the red cells don't form the sickle shape. They are nice round discs.
Because, and that was my next question, because I think Patricia asked, or not asked, but mentioned fetal hemoglobin at 19. So what does that mean?
So that means that 19% of the hemoglobin is baby hemoglobin. And that's a very good number. Actually, 20% is the number that I always quote to patients. That's our target. You get above 20%, and many of your symptoms will melt away. Occasionally, you'll have crises, but very, very infrequently.
Is that a naturally occurring thing?
So it can be naturally occurring if you have a mutation that causes you to have high fetal hemoglobin. And one of the things that's on the horizon is gene editing. And we know a gene that turns off fetal hemoglobin. And if we mutate that gene through gene editing, now the patient can have very high levels of fetal hemoglobin.
202-319-7810, 202-319-7810. We are having our Wellness Wednesday conversation. We are talking about sickle cell disease. If you have a comment or a question, give us a call. Cheryl, calling from Maryland. Thanks for hanging on, Cheryl. What's on your mind?
Hello.
Hi.
Though I have a long year's history with this, I'm going to kind of keep it kind of short. My spouse, who's 59 at this point, I've always known him to have the sickle cell trait. Mm-hmm. He retired in 2021, December. By February 2022, he started to have strokes. Went through a series of tests and trying to figure out why at Hopkins, and come to find out he has hemoglobin SC disease. Since February 2022, he's had 5 strokes, the most recent one in June 16th. He is now undergoing, once a month he does this, a red blood cell exchange apheresis, where they take out the sickle blood and infuse him with the healthy blood cells. And he's been going through this for a year. Has he had a stroke since then? Yes, a very, very small one. I think my question is, what can and I've had this conversation with him, but what can he look forward to? Like, is this something that obviously hasn't stopped the strokes, but, has it been heard of? And, what do you think about it, the red blood cell exchange?
So I think you're on the right treatment for the right problem. Red blood cell exchange is something that we know that without that, the risk of an adult having another stroke after they've had a first one is 50% if you don't do those red blood cell exchanges. Now, certainly patients can have recurring events, even with the red blood cell exchanges, but that is the best available therapy. And if you will, it's a temporary cure because it's taking out all the sickle cells and putting in transfused red cells that last for about a month.
Okay.
So do the sickle, does it reproduce itself? Like you're saying, it's temporary. It's taking out.
So it's temporary because his bone marrow continues to make red cells, and we can, usually you're left with 70% new blood cells and 30% of what you had, but over that month it's going to increase, and you want to keep it under about 30%.
So we're talking about a blood transfusion.
Yes.
Okay. I see.
Yes. Very, very lengthy process. He sits on the machine. He uses about 8 or 9 packs of healthy blood cells to transfuse out the old sickle cell.
Yep.
He's weakened after, but like I said, he did have a stroke or 2 since he's been on it. Mentally, he's been, just his brain has been altered from these strokes. So, I'm just, at this point concerned about his quality of life and, where does he kind of go from here? He's right now in a rehab facility undergoing, trying to get a little stronger, rehabilitated, but nothing is really working. So I just wanted to know about that.
Well, this is unfortunate, and this is the type of thing where he is probably old enough that he did not benefit from newborn screening.
Well,
we would have known this.
What? I have said this to his family, like, thank God this man is 58 years old. He's had his whole life
I've never seen him have an episode. So he's had his whole life to be kind of healthy and live it. But at this point, yes, it's affecting him.
Well,
I thank you.
And hemoglobin SC is the rarer form of sickle cell disease. It's a little bit milder until you have a crisis or a stroke or something severe like that. And I've certainly seen this. Maybe a decade or more ago, there was a young man who was in Afghanistan serving in the Army on a mountain at, 7,000 feet, and he had a splenic infarct, which is where your spleen dies in your organs, and he had hemoglobin SC. Nobody could figure out what was wrong with him in Afghanistan, and they sent him to Germany, sent him back to the United States, and I was one of the people who saw him, and it was clear to me, but it's simply amazing that somebody who could get through basic training in the Army, and then not only that, fight a battle up in the mountains. And, that's not the place you want to have a sickle cell pain crisis. So it can get missed, but it's usually somebody who didn't benefit from newborn screening.
Cheryl, thank you so much for sharing your story with us. And we certainly wish your husband the best of health.
Thank you. I appreciate that. God willing.
Thank you so much. I want to talk about quality of life with you, Ashanti, because you said you're from Indiana. You're a long way from home. Indiana to Howard University, that's a long walk. There's no question about it. What kind of considerations did you and your family have before coming to Howard, and more broadly, just going to college? What were those conversations like?
So my family did want me to go to an in-state college. I wanted to go to an HBCU because Indiana doesn't have an HBCU,
right,
unfortunately. So I knew that I wanted that experience. And so my mom especially, she was like, okay, well, at least find somewhere where there's a sickle cell clinic nearby or something like that, so then we could connect with them beforehand and make sure to get all the information we need to get to them. And when I found Howard University, when I found out that they had a clinic right on campus, I was like, okay, I feel like this is going to be the place, because they have an established sickle cell community, they have an established Black community, and that's something that I wanted to be a part of. So I worked with my physicians back at home, because I am a patient at the Indiana Hemophilia and Thrombosis Clinic. And so they sent me information over about the sickle cell clinic, about the doctors there and the people that I need to reach out to if I need help. And they kind of helped me really get set up to come here.
So you're a sophomore, so you've been here essentially one full school year. You're starting that second school year. How has being away from home, the adulting, as it were, for your health? I mean, how's it been?
My first year was rough.
Really?
Yes. Oh my goodness, it was so rough. And it's not like I haven't been away from home before. That wasn't the rough part about it, because as I said, I've taken a gap year. So I was living in different countries for months at a time. My first time adulting really was in Ireland. The only difference between that and coming here was I did not have my twin sister.
I see.
Yes, that was the biggest difference. She's an artist and an entrepreneur. She does not go to school, and her art is beautiful. So she's working on that back at home in Indiana, and I am here working on getting my biology degree. However, before I came here, the most time I had ever spent apart from her was 2 weeks, and I did not expect the shock to my system that I had experienced when I got here, just because we've always been into different things, and we've always been opposite. And she does not have sickle cell. And so when I came here and I experienced that shock, along with that came some mental health struggles, and along with that came stress and all of that, and I ended up having a crisis and an infection and a fever that sent me to the hospital my first semester here.
Mm-hmm.
And the stress definitely didn't help, because stress is a big thing. I need to make sure to keep my anxiety low and keep my stress low in order to not further complicate a crisis or trigger a crisis. And I was not doing a good job at taking care of myself because of that. And so I was in the hospital for about 6 days, and it really set me back academically, because before then I was doing fine. But after that hospitalization, it was rough. It was a struggle.
Yeah. And you know, again, Howard University certainly is in Ireland. So
yeah, but
no Blarney Stones, shillelaghs, or anything.
What I'm very happy about is being able to meet Dr. Taylor, because if I was not hospitalized, I don't believe I would have met him as soon as I did.
Okay.
And he has been a big part in helping me come out of that situation. He recommended a psychiatrist for me, and he told me, okay, Ashanti, I know your academics are rough right now, okay? But here's what we got to do. He said a whole plan. I was like, okay, I can follow these instructions. He said, day by day, person by person, phone call by phone call, you can do this, this, and this. He helped me with my appeal for my HU capstone, and I got it. Thank you. I got it back because my grades were not too good. They're fine now.
Okay, I was going to ask.
No, they're fine.
Did we need to call your mom?
Oh, she knows. I tell her everything.
Right.
She knows. But that is why I'm here today, because of the support system I was able to find here on campus, and because of my family. I call my sister every week at least, mostly on a daily basis, but I didn't want to say that out loud.
Yeah, well, and that's okay, because you, in addition to the physiological, as you said, the mental health in providing support for any illness that we may have is really, really important. And as I said, you're a long ways from home, and you have to find those support systems where you can. So feather in your cap, Dr. Taylor, certainly and I know what you're going to say. I'm just doing my job.
I am doing my job, but I have great insight into the disease and the effect on families, and it just can't be appreciated enough how important family is. And I see different reactions in different patients. Some want to insulate their family from a crisis and won't talk to them when they're in a hospital. When you're in the hospital, no matter what disease it is, that's when you need your family the most, and you need help. And she really hit the nail on the head. The stress, that is, she's relearning rules for life as an adult now and how to manage stress.
So here's my other question. Can you, for example, exercise now? And if so, how do you have to be careful how you exercise? What impact does this have on your social life? Well, you don't have a social life because you got to keep those grades up. So you're not allowed to go out. You need to stay in the books, of course. Right. But what is all of that like?
So, I played sports before high school when I was younger. I played soccer. I played basketball, volleyball, all that. I was into things. I liked being active. And then in high school, things kind of just got worse. I don't know what it was, but I wasn't playing anything then. But I exercise on a regular basis now. Okay, I said on a regular basis. Wait a second, let me correct myself. I try to exercise on a regular basis.
Yeah, we all are guilty. We're all guilty of that.
Right, let me not lie on this.
Right, I was supposed to go to the gym this morning. Didn't make it.
Yes, but I do try to exercise on a regular basis because that is important in managing my condition. I have to be exercising. I can't just not do it. But at the same time, I can't overexert myself. So I have to make sure to drink a lot of water.
Okay.
A lot. If I'm in a lot of pain from doing too much, I do, resort to ibuprofen to help, with the inflammation and everything, because I remember when I was playing those sports and I would be doing too much, my hands and my feet would swell up like crazy, and I couldn't make a fist really, because they would be so swollen. I'd be like, that's weird. And I would look at my friends, I'd be like, hey, are your hands swollen yet? And they'd be like, what are you talking about? I'm like, you know how that happens? They're like, nah, that's weird. I'm like, oh, my bad. So I would make sure to drink a lot of water, and I would make sure to not get too cold, because when you're sweating and you're outside or you're somewhere where it's a lot of AC, like in the gym or something, that extreme temperature change can trigger something. So I have to make sure to bring my sweats with me, along with my shorts and my sports bra, whatever, because I have to make sure that I create an environment that is compatible with what I need.
I didn't mention this before, and I think this is a really important piece. How, outside of the hydroxyurea, for example, how is sickle cell treated?
So now we have 4 drugs. Hydroxyurea, let's just put this in perspective. That was approved by the FDA 85 years after the first description of sickle cell. So we're 85 years behind. And then it was another 22 years before the next drug was approved. That was L-glutamine, 2017. And then 2 more came in 2019. So we now have 4 drugs. And if you throw in the blood exchanges that we've discussed, that's now 5 treatments. It's really wonderful to have 5 different treatments available for patients, because now if somebody doesn't take their hydroxyurea for whatever reason, they don't like it, it gives them too much nausea, something like that, now I have alternatives. And we can try something until it works.
How is it taken? Is it an injection? Is it a pill, the hydroxyurea?
It's oral.
Okay.
It's a pill. I take 3 of them once a day, which is 1,500 milligrams. And I got to tell you, my fetal hemoglobin is high. It's in the 20s, I'm saying.
Okay.
Yeah, I know. It's a flex. Yeah, I got a lot of that.
Yeah, I like it. Are the treatments expensive?
Hydroxyurea is not terribly expensive. The 3 other drugs are expensive. And the curative therapies that are on the horizon, gene therapy and gene editing, are terribly expensive, on the order of $4 million. So
my gracious.
My biggest concern is who's going to have access. I would love for everyone to, if they're willing, receive it.
Yeah. What, from your perspective, what is on the horizon for treatments, possible cures, discussions about cures?
So there are 3 potentially curative therapies. One can be done today. It's called a bone marrow transplant, but you have to have a brother or sister from the same parents who's a match, and that's less than 1 in 4. So it's kind of depends on how many brothers and sisters you have. The more you have, the more likely you are to have a match, but no guarantees. That comes at a price. We give you huge doses of chemotherapy before we give you the donor stem cells, and that could potentially kill you in a small percentage of patients, but certainly a risk. The other curative therapies, gene therapy is in front of the FDA right now. What we do there is take out your own stem cells, so you don't need a match, and we take them to the lab and we infect them with a virus that has a normal hemoglobin gene. We grow that up and give you a bone marrow transplant with your own stem cells.
How effective might that be?
It could be highly effective, and the beauty is now you don't need a donor. Again, because we're giving those huge doses of chemotherapy, there's a chance you could die. And I think we need to know those numbers before we bring that to all patients so that they can make an informed decision.
I actually have a question about that, because a few years ago I heard about this woman. She was in her early 20s, and she had sickle cell, and they used CRISPR gene editing to. I don't believe she had a bone marrow transplant. I think
she did.
She did.
So what CRISPR is, the same thing, only instead you take the stem cells out and you treat it with CRISPR, and it targets that fetal hemoglobin turn-off gene.
What is CRISPR?
CRISPR CRISPR-Cas9 is a set of enzymes that are normally in bacteria, and they nick and chew up DNA. And we can use this as a tool to inactivate a gene. So if we inactivate a gene that turns off fetal hemoglobin, what happens? Fetal hemoglobin goes up. So we take the stem cells out, treat them, and then transplant them back into you. CRISPR is a few patients have been treated, a handful right now. Results look promising, but we'll see in a few years. I'd like to see hundreds of patients treated before we really start advertising to patients. It's very cool, but again, expensive too, Ashanti. And how are we going to provide that to everyone who would like it?
Well, I would say, Ashanti, after this hour's worth of conversation, you can graduate with your biology degree next week because I feel so much better educated right now. I mean, this is a far cry from dissecting frogs, let me tell you. I want to make sure we do give your mom a bit of a shout out because I needed you to kind of briefly share that story in the next minute or so about what your mother did when you were a little girl to really bring awareness to this disease.
Yeah, my mom definitely deserves a shout out. Shout out, Mom. I love you. She did not even know of sickle cell before I was born. And she took it and she ran when she found out that I had this disease and when she found out how serious it was. So she started a nonprofit organization called Secure Networks, Inc. That's spelled SCACURE, Secure Networks. And they actually work with the Indiana Department of Health to do newborn screenings. Not do newborn screenings, but share those results with parents and make sure to coordinate between parents and physicians with the newborn screenings. And she participates in events for sickle cell awareness and all that. And she makes sure that I remain educated.
Mm-hmm. And healthy.
And healthy,
yeah.
Yes. Yes, because we have no medical professionals, no doctors, no nurses in my family. However, I was inspired by my disease and by my mom because she's such a helpful person to people in general. I was inspired to enter into that field, and that's what I want to do to help people like me. So
your mom sounds wonderful. Just a quick reminder, the Move On event for Howard University's Sickle Cell Center will not be held on September 23rd. It's been postponed because of the weather. That's going to be on September 30th, and we will make sure that we post that information on our website on WHUR.com. And real quick, where can somebody look for resources online for help about sickle cell?
I think one of the best websites is the Centers for Disease Control, has a variety of information. Also, I believe Emory University has a clearinghouse of information of many of the sickle cell clinics around the country. There is not one place to find them easily.
Okay. Dr. Taylor, Ashanti, thank you both for coming in. I really appreciate it. Good health to you.
thank you for having me.
Thank you.
And finally tonight, some quick thoughts about fighting sickle cell disease. A lot of people who look like me are impacted. And I remember those commercials from years ago. We still don't hear a lot about it, but that doesn't mean it's not an issue. There are all kinds of illness-related causes competing for our attention these days, so please do not forget about sickle cell. That is the Daily Drum for this Wednesday, September 20th. I'm Harold Fisher. Good night.
This program was produced by WHUT and made possible by contributions from viewers like you. For more information on this program or any other program, please visit our website at WHUT.org. Thank you.